We're here to celebrate our Mississippi hospitals during Hospital Week and to offer a proposal to move Mississippi in the right direction. Thank you all for being here. First, I'd like to show special appreciation to our board members that are with us today, especially Mr. Lester Diamond with St. Dominic's, our chairman of the board, and all of our friends and other association members that are here today in support of this project. Every day, Mississippi hospitals with their 62,000 employees serve our communities. Our doctors, our nurses, our staff are there 24/7, doors open, lights on, ready to comfort, treat, and cure. We celebrate the joyful times, the birth of life, the birth of a new child. We celebrate the discharge of a cancer survivor. We celebrate the loved one going home that's recovering from a heart attack or stroke. We're also there to comfort when things don't go as we planned. We stand with the police officers, the firemen, the ministers in times of emergency. Our hospital employees are your friends, your family, and your neighbors. We at MHA are proud to serve those who serve us all. We've been doing that since 1931, and we don't take it lightly. During National Hospital Week, it's important to recognize the great things our hospitals do every day. Our hospitals are leading the way in improving quality for our patients. Quality is not new. We've done it forever. But using new quality programs, we've seen tremendous increases in quality across the state of Mississippi. For instance, hospital-associated infections and adverse drug reactions are considerably down. 30-day all-cause readmissions are down 14%, which is actually ahead of our goal. Not only are hospitals places of healing, hospitals are economic drivers in our community. Without access to care, both our patients and our communities will not thrive. Without a hospital in your community, it is extremely difficult. It is extremely difficult to create new jobs. We've seen this in way of hospital closures. We've seen emergency room closures. We've seen the difficult struggles that our hospitals face across the state of Mississippi, both urban and rural. Uncompensated care cost has reached over $600 million in the state of Mississippi. Mississippi is among the highest in the country of medical debt. Now, that's not because our costs are too high. Our actual personal debt of medical debt is in the lower third in the country. Our problem is the need for care is so great that the way to pay for that care is so low. Unfortunately, we all know in Mississippi we rank high on those wrong characteristics from health care. Those being hypertension, heart disease, diabetes, and stroke. We have a high prevalence of cancer and obesity. If you couple those bad outcomes with the economic factors that we deal with in the state of Mississippi, you've created a perfect storm, not only for patients, but for providers as well. We believe we can do better. Health care is a quality of life. If Mississippi is going to improve the quality of life for our citizens, we cannot continue to do the same thing we've always done over and over and expect a different result. Plain and simple, what we're doing, particularly in Medicaid program, isn't working. Since 2015, emergency room visits for Medicaid patients has increased 155%. The cost of those visits has increased 46%. Medicaid alone expensed almost $160 million in admin fees last year, while our Medicaid managed care companies have been paid over $1 billion since 2011, $240 million of that just last year. Yet in that same period of time, Medicaid reports that 19% decrease in childhood screenings, a 14% decrease in the persistent asthmatics on appropriate medication, and have provided less diabetics with testing. Finally, there's been no taxpayer savings from this. The cost per Medicaid beneficiary has risen almost $1,400 since 2014. It's time to reform Medicaid. Unfortunately, many adults have no health coverage, health insurance. Having no insurance coverage limits their ability to pay for preventive and health care services. Yesterday was Mother's Day. Let's use that as an example. Put yourself in the position of a young mother of 3, teaching preschool. She gets sick. She has a decision to make. Am I going to pay for treatment? Am I going to go see the doctor? Or am I going to buy groceries this week? A very difficult decision. What if it gets worse? What if she makes the decision that mine and your mother probably would have made and take care of her family first? She puts off the treatment. She winds up in the emergency room because her condition gotten worse. Or even worse yet, she's hospitalized. She's no longer able to work. She can't take care of her family. Too often in our state, decisions to forego preventive health care and treatment are happening. It's happening to moms and dads, family members, neighbors, church members, all across the state of Mississippi. That should not be a consideration in the state of Mississippi. We shouldn't have to decide if choosing health care is the right decision. What better time than National Hospital Week to propose a solution to improve access to care in communities across Mississippi? I'm excited to announce a new proposal. That proposal is Mississippi Cares. Mississippi Cares is a proposed public-private partnership between the state, the federal government, hospitals, and plan members to create a better, more appropriate access to health care for non-disabled adults, many of whom are already working hard to provide for their families. Let me be clear, this is not Medicaid expansion. This is Medicaid reform. Many of you have heard then Governor Pence, current Vice President, say Medicaid was not a program to be expanded, but a program to be reformed. We agree with that. There's opportunities to do that. Under a special Medicaid waiver request, Mississippi hospitals will be willing to make an additional investment in the premiums needed to fund insurance coverage through a hospital provider-sponsored health plan. This plan would essentially be an insurance policy paid for by hospitals with a modest contribution of $20 or less for those adults falling under the 138% of federal poverty level. In Mississippi, this is about $17,000 a year. For a family of 4, it's approximately $34,000 a year. Hospital investments, personal premiums from plan members would help fund the needed 10% state share to match the 90% federal share. Not only will this proposal help Mississippians have access to health care they need when they need it, but it also helps to sustain that access for the rest of us across the state, particularly our rural areas. We believe that this proposal will reduce uncompensated care by 40 to 50%, thereby strengthening our rural hospitals and benefiting our urban hospitals. Most importantly, we believe this proposal will create a healthier and more productive workforce in our state. Our workforce won't have to decide whether it is right to buy groceries or have a mammogram. Why a provider-sponsored health plan? Because that's Medicaid reform. The current Medicaid model has not worked and will not work until providers and patients both are empowered and held accountable for choosing the appropriate utilization of health care services. We've paid out to managed care companies over $1 billion of administrative fees and have nothing to show for it. In a conservative state like ours, how can this possibly be fiscally conservative? Like any smart investor, if hospitals are going to be a significant investor in this effort, they want to put their money on something that they believe in, something they have confidence in that will work, not the same old frayed system. So a health plan owned by hospitals ought to have both the opportunity and the responsibility to take care of these patients. Well-established provider-led plans have demonstrated that they can improve health outcomes, spend less on their administrative costs. If given the chance, we know we can provide this. Obviously, this proposal is great for Mississippi healthcare. It's also great for Mississippi. We believe that this plan will pump more than $1 billion of revenue into the state, create 19,000 jobs, improve personal income by over $600 million, and increase the general fund from $50 to $100 million a year. Oh, did I say no tax dollars? Under Mississippi Cares, hospital investments and member premiums fund the premium for Mississippi True with no state funding. This is a nonpartisan proposal. It's a proposal which helps all Mississippians, whether you receive health insurance through this program or it simply increases the access to care for us all. Over the next 10 years, it will provide billions of dollars for the state of Mississippi. Now, what does that mean to the state of Mississippi? What would it mean for roads and bridges, colleges, schools, teachers, our kids? During this National Hospital Week, we celebrate our hospitals, which not only are leading the way in patient care, but they're leading the way to solutions that will move our state in the right direction, not only in healthcare, but economic. Where others won't lead, Mississippi hospitals will. We hope you will join us in building a healthier Mississippi for our friends and neighbors by supporting Mississippi Cares. We're your family, your friends, your neighbors. We are your Mississippi hospitals. Thank you all for being here. We appreciate the support.